Why natural immunity against COVID-19 is not as good as vaccination, according to doctors. The US has surpassed 46 million confirmed cases of COVID-19, the disease caused by the novel coronavirus, and natural immunity from a prior infection may not be enough to rely on when considering the ultimate aim of reducing hospitalization and death caused by transmission, especially when it comes to mitigating the threat to the most vulnerable among us. The problem with natural immunity is that A, it's not as good as vaccination, and B, it does wane over time and people get reinfected if you don't follow that up with a vaccination, University of Virginia Assistant Professor of Medicine Dr. Tyson Bell said on Yahoo Finance Live. Other medical experts have said similar. This idea of really building our immunological protection at a population level just based on natural infection, first of all, is super dangerous, Dr. Kerry Althoff, Associate Professor of Epidemiology at Johns Hopkins Bloomberg School of Public Health, told Yahoo Finance. This idea of really building our immunological protection at a population level just based on natural infection, first of all, is super dangerous. An estimated 757,000 Americans have died from COVID-19. Many Americans who decline vaccination against COVID-19 argue that their natural immunity from prior infection should be enough to protect them and others instead of a vaccine. Furthermore, the argument goes, populations will eventually reach a point of strong immunity against hospitalization and death from COVID-19 through a combination of vaccination and natural immunity, a concept known as endemicity. Preventive medicine specialist Dr. David Katz told Yahoo Finance Live that immunity from natural COVID-19 infection ought to count too. Those vaccinations should be freed up for others who need them more, whether it's boosters or distributions around the world. And Pennsylvania-based St. Luke's University Health Network announced back in September that it would allow such individuals who work for them to defer getting the COVID-19 vaccine for 12 months after their infection. This comes after a study conducted in Israel found that natural immunity offered stronger and longer-lasting protection against the Delta strain of the coronavirus than those who hadn't been infected but were fully vaccinated. However, according to Dr. Bell, the nature of the virus is to come in cycles and waves. And over time, when another wave comes, when that natural immunity has gone down, you have a population that's still not protected again. So I fear that's what we're going to see. Dr. Howie Foreman, a professor of radiology and public health at Yale University, told Yahoo Finance that there are important caveats that should be taken into consideration with natural immunity. Logistically, allowing individuals to substitute prior infection for vaccination requires documentation of prior infection and, less certainly, current antibody status, Foreman said. Logistically, allowing individuals to substitute prior infection for vaccination requires documentation of prior infection and, less certainly, current antibody status. A study published by the Centers for Disease Control and Prevention, CDC, found that prior COVID infection does not guarantee an antibody response, meaning that those hoping natural immunity will provide them with an alternative to the COVID-19 vaccine may not be successful. It's one more study that says that a certain percent of the population does not develop antibodies, at least measurable antibodies after infection, Foreman said. It starts to help us understand which groups are less likely to develop antibodies. According to the study, it's one more study that says that a certain percent of the population does not develop antibodies, at least measurable antibodies after infection. Non-seroconversion means that the infected person's immune system was not able to develop antibodies despite exposure. In other words, younger people seem to be less likely to develop antibodies, and development of antibodies depends significantly on their viral load, i.e. the severity of their infection. The higher the viral load, generally, the more likely a person is to have developed antibodies. Consequently, the CDC report warned against believing natural immunity is definitively more effective than vaccination. RT-PCR positive persons who experienced COVID-19 symptoms might be less inclined to seek vaccination, believing they are protected, but our results caution against this assumption. Nevertheless, there are clearly some individuals who would rather gain natural immunity by purposely being infected than getting the vaccine. For example, a group of individuals in Canada held a COVID party with the intention of producing antibodies after being exposed to the virus. A number of them were hospitalized as a result. There is no good logic that says you should get infected instead of vaccinated, Foreman said. There is no good logic that says you should get infected instead of vaccinated. There is still much to be learned about the coronavirus and its long-term effects, including how long antibodies created after infection last in a person's system and why some develop them while others don't. The CDC report indicating varied natural immunity response doesn't answer the question of whether people without measurable antibodies but documented prior infections might still have protections, Foreman said. Doesn't answer the question of whether people without measurable antibodies but documented prior infections might still have protections. And while it's not clear how many vaccinated individuals previously had a COVID-19 infection, research indicates that those people with hybrid immunity from both natural immunity and inoculation might have the strongest antibody response of all. In any case, the critical factor is vaccination and booster shots at some point, whether or not prior infection occurred. Vaccines are the way to go, stressed Althoff, the epidemiologist at Johns Hopkins. We have good data to show people are responding and responding well, and that antibody response hangs in there for quite a few months. The whole discussion about boosters right now is coming into play because that antibody response is starting to wane in some, and that's especially risky if we see strong evidence that it's waning in older folks or those types of higher risk individuals. For more videos like this, subscribe to my YouTube